November isn't just the start of the holiday season. It's also known as Movember, a global movement to raise awareness for men's health. And a new report from the Movember Institute of Men's Health is telling us that 53% of male deaths happen in the U.S. before the age of 75, which is the standard threshold for premature mortality in high-income nations. What does this all mean? Joining me to discuss the report, the real face of men's health, is co-author Brian Heilman. Brian, good to see you. So I know you're a senior researcher at the Movember Research Institute. Why are outcomes so bad for men in the U.S.? What are we doing wrong?
Yeah, I mean, obviously, comparing the United States to any other country is always going to be difficult. We have a very big and diverse population. But what we really focus on is how few guys have access to very high quality and affordable health care near them in their neighborhoods. And also these persistent stigmas that tell guys in these social messages we're aware of that guys should tough it out, that seeking help is a sign of weakness. We need to both increase the access of high quality health care and also chip away at those stigmas and stereotypes.
So how do we do that?
Yeah, I mean, it's that's what Movember is here to do. You can see I'm wearing a mustache. I usually don't do that. For the month of Movember, people who are part of the Movember movement grow a mustache or commit to move a certain number of miles as a way to make it easier to have conversations about these issues that matter so much. It can be kind of hard to start off a conversation with your friends or family about the risks of suicide among men or prostate cancer, testicular cancer, these cancers that affect men. But when you're wearing a mustache, your friends or your family are going to tease you about it. Like, hang on, Brian, you don't usually have this fashion choice on your lip. And all of a sudden it gives me a chance to say, hey, well, yeah, it's not just a silly fashion choice. It's because I really believe in this cause. And that movement has really worked for our organization over about 20 years.
Well, and I know you've had a lot of high-powered partners like Glenn Powell, Coleman Domingo, even Prince Harry working with your organization. Now, your study found that 43% of men said that skipping their annual checkup was just a, quote, guy thing. How do we fix that?
Yeah, that's exactly it. Those are the stigmas that we need to keep chipping away against. But the distinction I like to draw about that statistic is that isn't necessarily those guys saying that that's their personal value. They feel that it's important to skip checkups. They've inherited this message, this stereotype that it's a guy thing to do that. In fact, 95% of men in our survey told us that it was a sign of strength to look after your health care. And guys consistently tell us that when you ask their personal value, they really want to be healthy and want to be there to care for their family members, right? and show up the ways that their family expects of them. So there's kind of this distinction between guys' individual values and attitudes versus these persistent stereotypes that are still out there.
Brian, appreciate you and your research. And the mustache, it's working for you.
All right. Thank you so much, Kira.
All right.